I'm Anant Koppar, Chairman and CEO of KTwo Technology Solutions, a IT product company based in Bangalore.
So tell us about your organization and the work which you're doing in India.
KTwo Technology Solutions is primarily a IT products company focused on providing rural health care and trying to provide the kind of facilities which are there in an ICU at the doorsteps of a villager, where he will be able to do get some care at the force, accessible care and affordable care at his doorstep.
So what are the demographic area which you are focusing?
Currently we are focused on India, but also we are trying to expand into the African countries, sub-Saharan African countries, and the Southeast Asian countries. And then once we are successful in these areas, we will move on to Europe and US.
So how many villages are you catering to?
Currently we have a large network of telemedicine systems in Bihar. This is part of the National Rural Ayush Network. We are covering around 250 villages connected to 38 district hospitals and a state command center where there are doctors. So at the primary level we can do all the clinical checks, starting from measuring the vitals like BP, ECG, temperature, and doing the urine tests. A whole lot of other tests like malaria test and tuberculosis test can be done on the system, and this data is available to a doctor in a remote location or in the same location, and doctor at his time can do the prescription and send the prescription back. So that way the villager will get services at an affordable price.
And do you think that telemedicine can help us in overcoming the paucity of doctors and nurses in the rural areas and far-fledged areas in the country?
Yeah, definitely. I think the issue is non-availability of doctors and experts at the village level. What needs to be done is to see how we can assist those doctors by providing them clinical data. If you look at the initial earlier telemedicine systems, they were more focused on the tele part of the telemedicine, not on the medicine part of the telemedicine, where we as a doctor, the doctor needs a lot of clinical information, and if that clinical information can be automatically measured and sent it to him with accuracy, then we don't need to have the doctors at those locations. We can have lesser qualified technicians or paramedics who can do this job.
So tell us about some of the unique solutions that you have in place in India.
The first solution we have is the Kshema kiosk. Kshema means well-being. So this is a kiosk which comes with all the accessories, computer system, integrated electronic health records, then the medical tests, then consultation and the video conference, and a whole lot of things which are required for the telemedicine. This can be operated by a mere 10th passed computer literate person. So we are generating employment also in that sense to people in these villages. Once the patient comes in, the technician looks at the data and then sends that data to a doctor elsewhere, or doctor can be in the same location as well. So this is one of the flagship products, and we've been very successful in that area because there have been companies for the last 15-20 years in telemedicine. We are now able to set up a very large network. I believe that this is the largest network in India, as we're building that network now. The second product we have is a product called K-Prathamik. This is for, again, primary care, more focused on the villagers. In the villages, the ASHA workers or the ANMs go around and collect data about the patients and the villagers. So we have a kit which is a briefcase kit which is powered by battery. She can go around, he or she can go around and look at the patients, measure their vitals, create the data, the electronic data for each of the patients, and then bring back and upload into a PHC kiosk and things like that. This Prathamik also runs a software which is a mother and child care or child tracking system, where we track the mother to be from the conception till the immunization for 5 years of the child. So the entire activities which are done by ANMs through National Rural Health Mission can be covered in this software, and it has a lot of alerts for both the patient as well as the doctors, the paramedics, the ANMs who are involved in the process. So this is the second product.
How are you using cloud technology in improving the healthcare services and delivering the healthcare services?
Currently, what is happening is we are spreading the hub level or the spoke level systems. At the hub, which is the cloud, we currently have all the data available. For example, from a village PHC, the data comes into the district hospital, and then from the district it will get into the state center. In the state center we have a cloud-based solution where we collect all the data. So the initial use of cloud has been in getting proper analysis of data done. And if the data is collected in data points, then it is easier to do the thing. So we have built software which is based on data points so that we can easily do a good analysis. For example, now in the mission director's office, he can look at how many patients of a particular type came in a village at a particular time. So this is all a system which is cloud based, but it is important in the healthcare not to just have the cloud because it's only city centric. We need to have the base level systems which can provide that data automatically, and that I think is a bigger challenge for all of us. And addressing that challenge.
And what are your views on public-private partnership? Because we think that private players are important in delivering these telemedicine services, in providing a better technology.
Yeah, I think it is a very important thing that the private sector has to get involved. Unlike in other sectors where PPP means everything is taken care by the private player, where the 100% risk is on the private player. It may work in those, for example, in a road construction. Once you construct a road, people are forced to use it, whether they like it or not. But in a sector like healthcare, it is not that way. You can't force people to use this. So I don't know if I set up a service, how many people will use it. So the risks for the private sector player are very high. And because of that, many of the larger companies, enterprises are not interested in entering into such a partnership. So we need to have a proper risk sharing kind of a PPP model where both the private and the public as well as the users will get benefited.
So do you think that there is a high need of a unique promotional campaign which can showcase your services, and the people also know that this is the service which can actually change the life of the people in the healthcare sector?
I think there is healthcare, we need to do more propaganda now, as you said, promotion. We need to do that promotion, and one of the challenges I have faced in the company is that this is a new area where you have to create the market. For example, when we had in the 90s, early 90s, it was very difficult to get a telephone line. So people never used to use phones. As the telephone lines became properly, and then the concept of STD booths came in, Sam Petroda's concept of booths. So people started using that phone, and the usage became so much. Now they are missing those phones. Not so much missing because the availability of mobile phones. So what we need to create is, today if I feel uneasy, I normally don't want to go to a doctor. I'll see if I can recover from my body thing. But if I make a system where I'm not bothered, I'm going and doing my initial checks without even consulting a doctor. Can I do that today? It is not possible. So I want to create kind of these booths. I call them myself these booths as Kshema diagnostic booths. You go there, you pay some money and say, I want BP checked, I want ECG checked. I don't care whether I should go to a doctor or not later. So if I can create that market, I think it will be a wonderful thing for the healthcare, because I believe that prevention is much better than cure. So if I know my BP is high, I will do my own ways of reducing that. Or if my sugar is high, I will know how to reduce that. So that way the awareness also will increase, and there is a need for big promotion in this area. This is a primary care.
And how has been your experience so far with this summit?
Summit has been very good. It was very encouraging to get this award for telemedicine. For a small and medium enterprise, this is a big feat. And I think many of these small and medium enterprises are geared to do innovation, but there is not much of a scope for them to be in the limelight. I think this eINDIA award has given us that limelight for getting into the telemedicine.
Thank you so much, sir. It's a pleasure having word with you. Thanks.